Welcome back, everybody. Texas Oncology has taken a lot of steps to remain open and available to all of its patients during this coronavirus crisis. Now, this week, the practice announced that they have accelerated the expansion of their telemedicine capabilities. To tell us more, we have Dr. Debra Patt, the Executive Vice President of Public Policy and Strategic Initiatives at Texas Oncology, joining us right now. Good morning, Dr. Patt. First off, let us know how the COVID-19 outbreak has impacted cancer treatment the way you deliver it.
I would say COVID-19 has impacted us all. We've all had to change the way we do things, whether it's how we educate our children, how we work, how we see our loved ones, and also it impacts how we receive cancer care. I would say one difference in cancer care in comparison to many other things in our life is that by and large it's not something that we can put on pause for a period of time, because cancer patients with active cancer generally need treatment and need treatment to continue. It's not something that, generally speaking, can be paused for a number of months without an adverse consequence to the patient. So at Texas Oncology, we've had to think a lot about how we continue to deliver the highest quality of cancer care in our communities while reducing the risk for our patients and the staff who serve them. Part of that has been innovation and embracing innovation with telemedicine. This has allowed us to take many of our follow-up visits and new patient consults to the virtual space, thus allowing a decreased volume in our clinics and our patients that have to come in to receive treatment during this time to have that be a safer distancing environment so they can continue to get cancer care effectively and safely.
Now, are you coordinating with other locations that you have in order to provide the exact same treatment to the patient at the time that they need it?
We are coordinating. It's a statewide effort. Texas Oncology has 221 sites of service across the state of Texas. And so not only do we coordinate, we have daily task force calls to coordinate our efforts across the state and make sure our patients are getting what they need and our staff are being supported appropriately. But also some patients that had traveled for cancer care previously have come to Texas Oncology because they don't choose to travel for their cancer care now and are able to get high-quality cancer care close to home. So that's been a better solution for a lot of cancer patients in Texas.
Last question, how critical is it to make sure that a cancer patient gets treatment during this COVID-19 crisis?
It is critical. The natural consequence of cancer patients not receiving treatment is they'll have adverse outcomes because of the cancer. So while there is individual variability between cancers, and these are important conversations that patients need to have with their doctors, in general, cancer patients require cancer therapy. Whether that's surgery or chemotherapy or other therapies, it's important that they have those important discussions with their doctor and they continue as appropriate. One of the ways they can have those discussions is through a telemedicine platform. So one of the things that we have done is allowed virtual visits. And I'll say in my own clinic, about 80% of my patients are seen virtually. I've evaluated new patients through the telemedicine platform. And it's one way to facilitate patients getting this evaluation in a safe and effective way.
Dr. Patt, thank you so very much for joining us and letting us know exactly what is needed during this time for those patients who really need the medical care. Thank you for joining us.